And hopefully you all can see my screen. But thank you all so much for coming to the COVID meetup and check-in. We are having these every other week on Tuesdays from 3 to 4 p.m. So our next one will be on the 21st. And thank you all for coming and attending today. So for today's agenda, here is what we're hoping to talk about. The first thing is doing our 3 deep breaths and taking some time for ourselves to relax and ground. And then talking about mask policies in libraries. Connie Behe from Imagine if Kalispell will talk a little bit about her library's process for instituting mask requirements. And then we can talk a little bit about it and see if anyone else has any questions or is also doing that. We wanted to talk a little bit about contact tracing and library privacy concerns. This is more of I think a theoretical question at this point. It's not something that people are immediately having to deal with, but as we all monitor what happens with COVID, just something to maybe start thinking about in the future. And then we wanted to have some time to talk about virtual programming. At this point, it's been 3 months since we've all been in social distancing or physical distancing, not social distancing, physical distancing. And I thought it'd be good to check in and see where we're at with virtual programming and how libraries are adjusting to that. And then we'll also have time for announcements and your resources. Feel free to bring up any other questions or topics at any point during the webinar. I will be monitoring the chat box, and so we don't have to stick to this agenda. We can always move to something else that is of concern to you all. The first thing that I want to do, though, is our 3 deep breaths. So if you could, I put a rainy picture on here because it has been so rainy. Also, I just personally enjoy a nice, quiet solitude in the woods as you're driving through. And there's rain falling and it's very atmospheric. So put yourself into that mindset and try and sit or stand up straight in your chair or on the floor. If it helps you, you can bring your shoulders back and down and really try and open up your collarbones and your chest cavity. Sometimes it helps if you kind of pretend you have a little string on your belly button and you just kind of boop, lift it up. Look straight ahead. If you want to do cactus arms, you can totally do that. As you breathe in, you put your arms up. As you breathe out, you put them down at 90-degree angles like a cactus. Or you can put your hands at your heart or on top of your thighs, wherever's comfortable. And we'll do 3 deep breaths. And remember to breathe deep into your belly, not just with your chest, and really air out those nooks and crannies in your body. So breathe in. And out. In. Out. In. And out. Okay. So our first topic for today is talking about mask policies in libraries. So this is something that has come up in the past few meetups. And I know that some libraries here in Montana have instituted mask requirements in libraries. Others have thought about doing that. So if you have questions about that or your library is thinking about doing that, feel free to put any questions that you have in the chat box and we can all discuss those together. Before I have Connie talk a little bit about Imagine If's process, I do want to remind you that there are some examples in the COVID-19 reopening guide. So examples for policy language, so the actual text from a mask policy and what that looks like. and then also things to think about and some general guidance from other state library agencies to kind of help you through that process. But Connie, if you're on the call right now, if you want to go ahead and unmute yourself and we can talk a little bit about what ImagineIF did, and if you want to share what your library went through with that process. And I'll also pull up your PDF as well.
Great, thank you. Hi, everyone. We recently, on June 25th, the board agreed to require face coverings in the library for all members of the public coming into our buildings. I'm in Flathead County, by the way, if I don't know you all. And the largest library location is in Kalispell. Just to kind of set the scene a little bit for you, pre-pandemic, we would regularly see, on average, 1,000 people a day at our 3 locations, 800 of whom would come through Kalispell. And I don't think that number was ever really understood when we're trying to convince people of how busy we are, until there has been a pandemic and suddenly we're all so aware of the number of people around us. We tried to reopen with being open less hours, and we spent a lot of money on plexiglass, wayfinding tape, social distancing. We had stanchions, you know, those things that banks use to keep people in line or at the movies or something like that. For 2 weeks. And what we found was that it's just human nature to kind of inch around all of those barriers. And that I think we're giving people a false sense of security because we had very low count at the time of people with COVID cases. There was a little bit of a lull or a reprieve. And so not only were we feeling insecure about the whole situation ourselves, but I think we led people to believe it was okay. So at first we just recommended and had signage up and everything like that for people to come in with a mask on. And so I knew I needed to go to the board to ask for the requirement. Our county public health official said that the businesses and organizations have the authority to require face coverings coming into their locations. That the local government wouldn't do it from a county or a city perspective, from that wide of a perspective, but we could do it. She recommended we get board approval, so we wanted to do it that way. After listening in on a few of these calls and also seeing from Belgrade, Gail Bacon's very simple policy, and talking to so many library directors, Gavin and Billings, Abby and Polson, Honor, Mark in Bitterroot, Susie in Great Falls, just talking to everyone to try to put the information together for how could we ask for this, because we know it became so politicized. I know Montana is a conservative state. In our particular area in Northwest Montana, it has become very extreme and very polarized. So, and sometimes volatile and hostile. So we want to be very careful. And so this is the way, this document is the way that we positioned the conversation with the board. We had Hillary Hansen, our Flathead County Public Health Officer, come to the meeting. All of our meetings are on Zoom right now. And Pat McCarthy, he's a specialist from Payne West Insurance, and that is the workers' comp insurance that our county uses. So regularly he would come around and make sure that all of our desks are set up ergonomically, and if anyone has a return to work situation we need to work out, he would come help us with that. I had called him a few days before the meeting and asked him, he's an industrial hygienist as well, asked him about masks and all the other things that we were doing. And he said that he wrote up a great email for me to share with the board and agreed to come to the meeting. And I think that this really helped everyone to see from an expert's position what should be happening. He did point out that we have multiple staff members who are 55 and older on the front line, and that we are doing everything that we could except for requiring face coverings that would keep us safe. So I felt like the message that we were trying everything possible before going to this possibly volatile decision that would have people maybe have confrontations with us. So wanted to set out an objective for the board because it is so politicized. We want to make sure that during the conversation that we can keep pointing back to what we're trying to accomplish. And that is to make it so anyone can use the library, and also to provide face-to-face services as much as we can for the duration of the pandemic. And we know that if multiple staff get sick at one time, or if the library becomes a hotspot for viral transmission because we've given a false sense of security, that we would have to close our doors because we just don't have enough staff to be open, and we'd have to do contact tracing and things like that. So really, humanely, it's so that we don't get sick with a risky disease. However, I think that this, showing the impact it would have on our services, could be good. So issues with the that we were facing is that again, if multiple staff get sick, we'd have to close our doors. We have people over the age of 55 with health histories that make them vulnerable, and that we need precautionary measures in addition to what we were doing. We put out 4 solutions. We could continue with the hours that we were doing, and we looked at even just for 2 weeks that we were open, we had in Kalispell about 400 people a day coming in. What do you define as multiple staff? We have 8 staff members who are 55 and over, most of whom are in the frontline position. There are, I think, 2 who are in the backstage, just answering a question from chat there. So we could just keep on going how we're going and have those issues possibly come up with people not, as we're watching them, not really adhering to the social distancing guidelines that we had put in place. Or we could further reduce the hours and limit the number of people coming into the building at one time. So we've already put limits on we've put plexiglass around our computers. We already limit it to only 30 minutes a day. We have a lot of people coming in to do resumes, and our job service is closed. So that would be a big impact for the community if we were to reduce hours and reduce computers and things like that. Or we can go back to closing the buildings completely and return to just virtual services. We are lending devices now, curbside, and allow patrons to enter by appointment only, or to require face coverings with flexibility. I'll explain those in a moment. And that way we're able to remain open to expanded face-to-face services for now. And I went through all the things that we have done already. Again, plexiglass around staff and computer stations, limited number of computers. We have removed all of the seating, just have a few hard seats that are easy to wipe down. We are very interactive library, like a lot of us are, and we've removed all of the toys, all the things that make it really interesting for the kids to stay here longer. And we have a custodian wiping things down frequently throughout the day. We've discouraged all lingering and gathering, no programs, that kind of, no in-person programs. We have lots of virtual programs. We're quarantining materials for 3 days in our meeting room, so there's no meeting room. We've increased the ventilation for our HVAC system to 30% intake from outside, which will be fine until it gets really hot, or during smoke season, we may be required to go to less. We have open windows and doors when we can. Staff are all required to wear face coverings. We do have hourly mask breaks for staff, and the industrial hygienist thought that was a really good thing. He hadn't heard of that before. It's kind of a psychological break as well as a kind of a break from the mask. By the way, we found that we have gotten used to wearing them, and OSHA is on board with that as well. Schedule frequent hand washing breaks for staff, especially if you're handling the book drop, but we've made it so like it's worked into your schedule, go take a hand washing break. So how's it going? We provided these graphs so our board could see the traffic. This one up here, you can see the 3 different locations with Kalispell, the highest there. So I was pointing out the one Tuesday, we had almost 400 people in the building, consistently about 350 people daily. And then we had expanded hours, so we're open about 8 hours a day in Kalispell now. And you can see it's consistently up above 300 people in the building. And if we scroll down a little bit more, again, so this is just another way of looking at the foot traffic. Blue and shorter hours, orange with expanded. Other county departments, I was surprised to learn this because I felt like we had some pressure to open, but other county departments, I went to a recent meeting and they are not open to in-person traffic like we are. They have, they're either behind a desk. I'm not sure if you have this right, in our library, though, we have these perches, we call them. We have a roving customer service model. We removed all large desks, which was really great until the pandemic, but it made it really easy for us to feel connected and accessible to other people. And now we want the opposite. So there's no way to completely enclose those spaces like there are ways to do that in other departments. So our DMV, for example, can only accommodate 6 people with social distancing. So they're still doing, I think, maybe by appointment only or online help, and they don't want to have a line outside. So I just wanted to point out and give context where we were in comparison to other departments. At the time, I think there's more now. I've been seeing a lot of activity online the last couple of days, but at the time that I wrote this, imagine if in Great Falls were the only 2 big libraries open to in-person traffic. I think actually Lewis and Clark was, but I didn't realize. And Billings is open as of the 1st, and Missoula is going to open in August. Billings is expecting face masks to be worn, and Missoula will require, I think Missoula will have a city or county mandate. That makes it a little bit more support for them. 11 at that time, 11 libraries were requiring face coverings to enter the building. Mark and Bitterroot said they had previously, and they may implement them again in the future. And then I did include this, if you want to look at it later, there's the email from Pat McCarthy. I think, again, he makes some really good points, and from the perspective of a workers' comp or industrial hygienist, I think it added some clout to our request. And then I included a face covering resource list, and this is kind of an unscientific, just a gathering of different pieces of information we had, but I did put CDC on here. The Stanford School of Medicine also had something that they had posted. It was at the same time that the US Surgeon General had come out saying that masks promote freedom. So our ask to give us requirement of masks in order to stay open was right in alignment with the kind of the sea change that was happening. And now you can even see that just the timing of it has been good for us, because suddenly there is more of a nationwide change across the political spectrum, thinking that masks are important and starting to require them as more states have an uptick in cases. One board member was out of service floating a river, so she wasn't there, but the board very quickly said, yes, we need to make a motion. How do we do this? And so we had to make a motion giving us the authority to require face coverings for public and staff entering the building over the age of 2. And then we will formalize the policy next month, and we will base it on the Belgrade policy that was so simple and straightforward. We do have, for enforcement, we did not update our code of conduct policy, but our code of conduct policy has information in there describing if you're being disruptive or disrupting the normal business of the library and other things like that, that you will be given this progressive disciplinary kind of action. Sorry, someone's at my door. Sorry, someone's knocking on my door. So we're just going to go with that code of conduct too to enforce it. So if someone refuses to wear a mask or is having a problem with it, I was concerned about ADA compliance. If you are providing an acceptable, or excuse me, a reasonable accommodation, then I think ADA is, you're not at risk of violating ADA compliance. And we have so many ways to help people that are not actual browsing in the library. For example, the curbside service, we just launched a personal shopper service, so you can fill out online, form online and call us, and we'll kind of do a reader's advisory on steroids thing for you and check out things for you to come pick up. We're checking out Wi-Fi hotspots, laptops. We can do all kinds of things for people. So if we list out all those accommodations and it's not going to work and someone still can't come into the building, if it's an ideological argument, we've cautioned staff to just be super flexible, give a lot of space, and say, okay, but be swift if someone refuses to wear a mask in here because of ideological concerns like that. Because we wanted to avoid a prolonged conversation or confrontation where we'd actually be face to face with someone who is getting angrier and possibly spreading more virus that way. I've been pleasantly surprised, but kind of reluctant to say how well it is going. The first day we did have a few people who were upset because we're reading body language, yeah, I was there on the first day welcoming people with the mask. We are giving out, I should say, we are giving out free masks if people don't have them with them. Someone I did have to ask to leave that day. It could have gone the other way. It could have been me saying, okay, come in really quick. But most people are wearing them, grumbling a little bit. I think there is a sea change overall nationwide. And so it's been a little bit better than I thought it would be. One person, I see in the chat, someone had said, I can't wear a mask because I'm medically unable to wear a mask. We told her we'd be happy to give her curbside. That's good. A liability issue with distributing masks, not that I know of. And we have, looked into it, but I think a lot of this is not standardized because of, pandemic was just so new for everyone. I don't know of a liability issue with giving masks. I did tell a public health official that we would be doing it and she was fine with it. So I haven't seen that yet. One person did say, I have allergy issues. I can't wear the mask. And I said, well, I'd be happy to do any of these other things for you. And then she decided to wear the mask. She did threaten to have some type of legal action. She actually left 20 minutes later, very happy with a Wi-Fi hotspot. So I think with all of the other services we're able to provide, we can reach people possibly better with this requirement.
Awesome. Thank you so much, Connie, for explaining your library's process and also for sharing this document with us. I mean, it really is cool. There's just a lot of stuff in here that I hadn't really thought about. I think it's really smart you brought in the OSHA people and the workman's comp perspective, because the more evidence that you have, the more backup you have for this, the harder it is to argue with for most reasonable people. And that's also really great to hear that people for the most part have been reacting better than you thought they would. And like you said, there's so many other ways that the library can assist and can help. There's really, I understand why some people might be angry, but they're kind of just, I think they kind of realize that I'm being a little bit unreasonable because there's all these other ways that people can help me. And I think people are very, librarians are really quick to be like, I'm sorry, no, but we can do this instead. And it can be just as good or even better than what you were originally wanting to do. So in case you all didn't see, I put the COVID-19 reopening guide link into the chat box, and this PDF is attached in that reopening guide. If you scroll to the bottom, it's titled Imagine if Kalispell Proposal to Board Regarding Masks. And this is, Connie, correct me if this is wrong, this is actually for all of the Imagine if libraries, right? Not just Kalispell?
That's right. So Columbia Falls and Big Fork and Kalispell.
Okay, I just named it Kalispell because I don't know why, but it's for everybody. So just be aware of that when you're taking a look. But thank you again, Connie. This is really, really great to have all this research here and have it all in one place. And if this is something that you are thinking of doing at your library and bringing forth to your board or to your community, I think Connie's provided a great roadmap on what kind of information to collect and what kind of information to provide to show people that this is really a good and solid decision. So thank you so much, Connie, again, for sharing.
Yeah, thank you.
Are there any other questions about masks, about implementing a policy like that? Anything else that's come up in the library? I also stuck the link to the map of Montana library statuses into the chat box. I believe there are 59 libraries that have reported what their library is doing and what level of service they're at. So you can take a look at that and kind of compare and see what other people are doing. Dehanza asked, are many libraries opening their restrooms to the public? Connie said that our restrooms are open. I do remember, DeHanza, from previous conversations that some libraries have not opened their restrooms to the public just because they didn't have the capacity to clean them regularly. Nancy and Laurel says that ours are open. If anyone else has information to contribute, please feel free to put that in the chat box. And DeHanza, are you guys thinking about opening your restrooms, or are you not quite sure yet? And Mitch said the ones we can see from the front desk are open. He says, I mean see, not see into. DeHanza says she's not quite sure yet. Trudy says ours are open. We clean it when we notice someone has been in there. Starla says we won't be opening the bathrooms anytime soon. Fort Benton said we only have one and we go in and clean immediately after someone leaves. DeHanza elaborated they're on the second floor, which hasn't been opened. Ah, I see. Okay, any other questions? All right, I'm going to close out of this PDF. If you, again, have trouble finding this, it's in the guide. You're more than welcome to also email me if you aren't able to find it, and I can send it to you as well. Okay, we'll go ahead and move on. Also, sorry if you can hear my cat scratching on her scratching post. She has woken up. So we wanted to talk a little bit about contact tracing and privacy concerns. And just so that we're all on the same page, contact tracing is what people do when there's a known positive COVID case. Usually the health department will follow up with somebody and ask them, please give us a list of everybody that you've been in contact with, every location that you've been in, so that we can notify people and discover further positive cases if there are any from your interactions. From what I have read about contact tracing, you're just trying to get locations that you've been, and the health department is just trying to get in touch with everyone that you had contact with, and they're not necessarily releasing your personal information and saying that, you know, Susie whatever has COVID or whatever, and everyone knows who it is. They're just trying to see and control community spread. So this has come up a little bit in previous COVID meetups where people were asking about what to do in case there was a known COVID positive case that had come through the library. I think in previous conversations we had said that, you know, it's probably okay to say something like there was a known positive COVID case that was in the library on this day. So if you were in the library on this day, you might want to go and get a test or something like that. But here are some other concerns and things to think about. And I just want to preface all of this, that this is not official legal advice. I am definitely not a lawyer. So please do consult with your local government officials and your local legal experts and lawyers to get actual definitive advice on this. But these are some things that you can sort of think about so you're a little bit more prepared for those conversations if you're going to have them. So in Montana, the Library Records Confidentiality Act, which is part of the Montana Annotated Code, and let me actually real quick grab that link and put it into the chat box. Let me put that in there. So that defines a library record as anything that reveals what a person did in the library. So books that they check out, the computer that they used, how much time they spent on the computer, what they were looking at, et cetera, et cetera. It's unclear whether or not it covers a person's location, as in, were they in the library or not? So it could be argued that yes, that is covered as part of their library record, but it could also be argued that it's not part of that. So there's not a cut and dry response under the Library Records Confidentiality Act. With the Montana Constitution, Declaration of Rights, that could cover information about a person's location because it's about privacy and all of that. But again, it's not necessarily cut and dried. Out of curiosity, I was sort of wondering if any libraries were dealing with this issue currently, if this was something that their local health department had reached out to them about, or if other businesses have been dealing with. And on my next slide, I have a few resources to share of other states that have talked about this and how it relates to the library world. But yeah, I guess we were curious to see if this is something that is happening right now and that people are grappling with at the moment.
Well, I wanted to add something that I noticed last week. On Friday, I went to Yellowstone Art Museum. And when I went and signed in as a member and such, they had little yellow stickies, and they asked me to put down my email address and phone number for possible COVID contact, in case that came up as an incident of where they needed to do some contact tracing. And so I thought that was interesting. And, well, I don't know if it was mandatory at all because I went ahead and complied, but of course we're the COVID hotspot here in Billings, yay. But I thought that was kind of an interesting way of dealing with it, of, asking people when they came in to voluntarily give contact information.
Oh, that is very interesting, Suzanne. I think the resources that I have on the next page, they're like blog posts and people who are discussing this. They've all said, don't keep a log. That's like the one common thing that they've all said. And so, yeah, I wonder if that was something that their board decided or if that was something that was the local health department. Have you noticed any other organizations in Billings doing that?
No, that's the only one, but then that's the only kind of public, that's the only place I've been to other than like grocery stores and stuff. So
yeah. Let's see. Jody says, according to our public health folks, the nurses will only contact anyone who has been less than 6 feet with someone who tested positive for more than 15 minutes. So that's a good point. It's not everyone that you've been in proximity. There's certain criteria that they have to meet. Connie said, I am concerned with keeping logs. And Connie, I don't think you're the only person who's concerned with that. From what I know, I don't think any library has been asked to keep a log, and I don't think any libraries so far are keeping logs. I think that's kind of the gray area where if you're starting to collect this information without being asked to or without being part of like your local health department, I think that's where it kind of gets a little unsure about how the legality of that. Laura says, that seems like something that might be difficult to track. And Jody says, in other words, if we control our exposure to patrons through policies and procedures, libraries should be able to avoid needing to be involved with contact tracing. So that's also a really good point. If people are able to follow all of those rules for physical distancing, then they wouldn't necessarily meet the criteria to be part of the contact tracing net, I guess.
Amelia.
Yeah, Kara?
This is Kara. So a few of us were visiting with Jenny earlier, and she thought she might be late in joining this meeting and wanted to pass a couple of things along on this topic. First of all, that there is, as you said, no obligation to document library visits per se. If somebody from public health or official asks if you happen to know if somebody was in the library at a certain time, it would be acceptable to say yes, but it needn't be specific to those activities or the information that they sought in the library. Whereas if local officials are asking that you do require sign-ins, she would like to know about that. We may want to seek a legal opinion on that to determine whether, in fact, we are in a state of emergency that would warrant the waiving of the Library Records Confidentiality Act.
Awesome. Thanks for letting us know about that, Kara. So yes, as it sounds like so far in the chat, no one is collecting this information. No one has been asked to collect this information. I don't think anyone wants to collect this information, but if you are asked to collect this information, please do let us know. And that will, I think, help us determine what we should do in terms of next steps. Mitch says, I will shut it down if we're asked to log visitors. Yeah, I think that's in general, I think the library world in general is wanting to protect privacy and wanting to make sure that people are able to do what they need to do in the library without fear of repercussion. So yeah, I think if who knows, I think if situations are such that you are asked to do this, I think it's always okay to be like, pause, let me think about that. Starla says, when they ask the local convenience store, I will consider complying. That's also a very good point. If they're just singling out the library, that doesn't really make much sense. Cool. Any other questions about this? Again, as far as I've heard, none of the libraries have had to deal with this. No one has been asked. And even when I was doing some searching across the country, it didn't seem like anyone had been asked yet either. I think people, the contact tracers who are working, I think they're able to get the information they need by following up with individuals themselves. So they haven't had to ask for organizational help. But, you know, we just wanted to bring it up in case this does happen. And then I also wanted to share some blog posts and guidelines and some information that other states have considered about this. There are people who are talking about it. Again, none of this is official legal advice. It's really important that you consult with people locally, especially these blogs are either like federal or pertain to a different state, and laws can vary greatly from state to state. So it's really important that you take all of this with a grain of salt, and it's good to know what other people are doing and what kinds of conversations they're having, but it's always best to get authoritative opinions and information from people in state as well. So let me go ahead and put these links into the chat box. Any questions about this? Okay, so I'll go ahead and move on for now. So for the rest of the time, I thought that we could talk a little bit about virtual programming and see how people are feeling about that. I know when we all first started with shelter in place and physical distancing, there was just kind of an adjustment period as everyone was trying to figure out what worked best for their library, what resources they had, what they needed to invest in, et cetera, et cetera. So hopefully at, you know, I think we're around the 3-month mark, maybe 4-month mark. At this point, I think all of us have clear ideas of what's working, what's not working, what further support or questions we have. So this would be a great time to one, share what you all are doing, what programs have translated super well into virtual content, what ideas you have for the future. Two, to talk about what hasn't worked so well, what you're struggling with still, who you're having trouble reaching out to. And then also talking a little bit about tracking statistics and how you all are doing that. I think Jessica in our last COVID meetup talked about the types of statistics that she'll be asking for, that we at the State Library will be asking for with public library statistics and stuff, which is the number of virtual programs that you're doing, the number of live attendees, if you're able to get that number, and then the number of recording views, if you're able to get that number. So those are some things to think about. So if you have any tracking questions as well, please let me know. And then I also wanted to remind you all about the MSL Community Events Calendar. Again, this is what you can submit your library's virtual events to this calendar. And I've shared it with various statewide partners, and they've shared it to their contact lists. So this is for any programming that you're willing to have anyone attend. So if you have questions about it, let me know. And on that link, there's information on how to submit events if you would like. And then Jennifer had a question about, does anyone know about UV lighting, if it works or not, the cost for libraries and personnel? And Jennifer, I remember we talked about the UV option. I don't think it's come up recently, but when we were first talking about like what the standard should be for quarantining books and things like that. And I think not just with books, but with UV sanitation in general, it takes a long time for it to work. Like I think for the ones I've seen for phones, you have to let it sit in there for like 30 minutes to an hour in order for it to actually desanitize. So it didn't seem very, I think people had talked about wands or something like that. But it doesn't, I haven't heard very much about it since then.
We, at Butte Public Library, this is DeHanza, we had a wand that we had left over that we tried to use, but it was so long, it took so long to just hover it above the items. It didn't seem practical.
And Kara says, I believe this was covered briefly in the Realm study. And Kara, I was actually trying to remember if I had read something in there about that. I was like, I'm sure this is a question they've gotten before and are probably studying. So yay, Kara said that she'll check. Thanks, Kara. And Connie said that it's expensive to add to air filtration. And I'm guessing you're talking about UV stuff. I didn't know that you could add UV stuff to air filtration. And Laura said that inner pages could still be contaminated because it would just be the outer surfaces. So yeah, Jennifer, I guess the definitive answer is we don't know. She was thinking for cell phones. I think for something like a cell phone, I think that might be a little bit more feasible because there's not like the inner part that you'd have to open up or anything like that. But I think you'd have to do some research. I do think that in general, UV cleaning takes pretty long to do. And Connie says that our HVAC consultant told us about UV filtration. So that's pretty cool. And Starla said, so far the 3 days of quarantining seems to be the best. And Suzanne has added in a link for a cool robot for UV. An MIT project. That's cool if you guys want to take a look at that as well. Any other questions about UV stuff or also virtual programming? I know that a lot of people have been doing story times online. I'd be curious to know if people are doing things live or if they're recording things, what people seem to be most comfortable with. I haven't checked recently, but I do know that some publishers are extending their temporary licenses or loosening up publication restrictions. I think at first it was just through the summer, but now I think some have extended into the fall. Connie says that we're recording and uploading those to, I think you guys have a pretty active YouTube channel. I think I follow you on YouTube. So that seems to be working well. And Kara had just put a link to the Realm project, the systematic lit review on various types of disinfecting methods. So page 27 of that document, if you click on that link, will talk about UV stuff. And Connie says that they have Instagram, Facebook, YouTube. Have there been any challenges with engagement or translating programming over into a virtual setting? Out of curiosity, have people started lending out hotspots yet? Has that made a difference? Are people excited about that? Connie says, yes, folks are very excited. That's awesome to hear. A lot of the organizations that I've talked to and I've told them about the hotspot program have been very excited. So I hope you all don't mind. I've been telling them to tell people to call their public library. Kara says that it's indeterminate if UVA is effective, and if so, to what extent and under what circumstances. So again, if you want to take a look at that systematic lit review for more information, please do feel free to. Connie says that laptops and iPads are coming soon, I'm guessing for lending out to patrons. Dehanza asked, has anyone had a group that did not want to meet online? That's a really good question. Christine said, one of our board members is having some success with it. I'm guessing about the hotspots. And Suzanne said, don't forget to have people do surveys on the hotspots. Yes. And Starla said that I'm ready, I think, for the hotspot program. I had to map our area to see how accurate the provider's map was, so it's been pretty labor intensive. Wow, that does sound labor intensive, but I'm sure people will greatly appreciate having that map and knowing what service will work where. It's great to hear that people have been open and receptive to the hotspots. Dehanza, in regards to your question, I haven't yet heard from anyone who doesn't want to meet online, but I have heard about people who don't want to download Zoom. Like they don't want to put the client on their phone or on their computer, I think because of the security issues and concerns. So the workaround for that has been conference calling in, which you don't have to download anything for that. And I think some people are more comfortable with the conference call as opposed to doing something through the computer. So I haven't done very many conference calls. It's definitely something that you can do with Zoom if you want. I have I'm not as comfortable, I think, troubleshooting with conference calls, but if you need people to try it out, let me know and I'd be happy to call in and work on that. But I think that's worked for people who don't want to do it online. And I know that some people have started to, for summer reading stuff, they've been doing things outside, but it is important to think about how the weather will change eventually, and that won't be an option. So either things will have to move entirely online, or maybe in-person inside greatly modified, although it's also unclear if maybe things will have improved by the time the weather changes as well. And Starla said that my board hates to meet online and are electing not to. And then Laura said that there are always hacking issues. That is very true with Zoom. Starla said, I'm still offering our meeting with Zoom, even though the meeting is happening in person. It's complicated for me, but without offering it, I make it so that the public, by offering the Zoom meetings, you make it possible for the public to attend and have it be comfortable for them, I hope is what you're trying to say. I think is what you're trying to say. Does anyone have other virtual programming that's worked well, that they're happy with how it's gone? I know some people have been doing make and takes, dropping off craft things at the grocery store, and then having like a craft along online. Laura says, we have an online RPG that has been well received. That's awesome. That's super cool. Laura, you should share that on the MSL community forum. I might follow up with you about that. Connie says that Beanstack Online summer experience for all ages has been good, which is great to hear. Jennifer asks, what's an RPG? An RPG is a role-playing game, unless it's not. That's what I know RPG to be. Okay, yeah, so a role-playing game. So yeah, I'm guessing you have a bunch of puzzles and things that they have to work through. I've also seen ideas for online escape rooms, or virtual escape rooms, which have been kind of popular. And Laura, if you want to put a description of the role-playing game in the chat box, you're more than welcome to. And Dehanza had a question of whether it was through an outside group or if you created it in-house. Oh, and I'm just now realizing that it is almost 4 o'clock. So I'm going to actually move to the announcements and new resources. But if you do have to sign off, feel free to. Again, this part will be recorded, so you can always go back and listen later on if you want to know what happened in the last 5 minutes. Please do let me know also if you have other questions about virtual programming or things that you're struggling with or things that are challenging. I think multiple people are struggling with this, and not just in Montana, but across the country, and figuring out how to best adapt to it. So a few announcements and new resources. There are some new links that I added to the COVID reopening guide. So WebJunction has a bunch of public library reopening plans. If that's something that you still want to see examples for, want to see what other states are doing, you can take a look at that. There is also a Google Doc from the Youth Services librarians in Rhode Island. They have a bunch of reopening procedures for youth services spaces. And I mean, a lot of that stuff is kind of in line with just general library reopening plans, but there are, some things that I think are unique to every age group. And so this one is focused on teen services and how to best provide service to teens in a pandemic. So it's pretty, people are just kind of sharing experiences, asking questions, answering and providing support. So it's a great document to look through and get some inspiration and ideas from. So let me actually put those into the chat box. So this first one is the WebJunction thing. Here is the Rhode Island Google Doc. In case you hadn't seen it, there are school reopening guides from both the governor's office as well as OPI. So the governor released a reopening plan for schools, which is a shorter document, and then there is a much longer document from OPI on exact guidance for schools and educators about reopening for this next year. So both of those can be found on the covid19.mt.gov website and the Joint Information Center area, but I've also linked them here, and I will also go ahead and drop those into the chat box. So for public libraries, maybe it's not as immediately relevant, but you know, this is probably what the families and schools in your area will be looking at. Also, in case anyone is asking. I also wanted to mention that there were a couple of short webinars or videos that were shared. I forget from which state, but it was customer service training, specifically related to unpleasant conversations during a pandemic and communicating with a mask on. And I think this first one, unpleasant conversations during a pandemic, might be more immediately relevant with some of the struggles that some libraries have had with, you know, people being angry or upset or, you know, just unhappy with certain policies, and especially regarding masks or library services. So there were just some really great tips in here, really good concrete things that you could practice when you're interacting with an upset or angry patron, and ways to make sure that you are still able to listen to them, but you're also able to kind of stand your ground and also make sure that you feel safe, and to, I think, hopefully make you feel a little bit more empowered when you're having those conversations too. Because the worst thing is feeling kind of helpless and that you're kind of trapped in those kinds of situations. Yes, Laura, I'm gonna actually drop those into the chat box right now, the link to these. So this is unpleasant conversations. They're also very short. This unpleasant conversations one is about 9 minutes, and this other one is 8 minutes. And with all of these things, you know, the best thing is you got to practice. And unfortunately, it sounds like some of you will have many opportunities to practice, but sometimes, you know, maybe you just got to get your friend to, you know, just reenact something with you, and try it out. It really is just like practicing moving your mouth and making those sounds and saying that, you know, I understand why you're upset. I understand how this could be unpleasant for you. This is our policy and we do ask that you adhere to it. And let's see, a couple other things to share. There is a STEM grant opportunity with NASA and the Jet Propulsion Lab. And I actually haven't had a chance to take a look at this super closely, but I did want to pass it along, and I will be sharing this on Wired as well. But they are looking for proposals for libraries that are interested in working with STEM programming, and they're offering grants for this kind of work. So if that's something that you're passionate about and are interested in, please do take a look at this proposal. Feel free to talk with me as well if you just need someone to bounce ideas off of. I can also put you in touch with people who might know more about the grant. The proposal due date is August 13th, though, so it is coming up kind of close. And the last thing is, again, the Realm project and an update on that. They have chosen 5 new materials to test for the second round. And they started testing on the 23rd, June 23rd, and they are hoping to release results in late July. So the items are Braille paper pages, glossy paper pages, magazine pages, board books, and archival folders. So again, I would recommend checking back with the Realm project to see what new information is coming out, but we will also update you on anything that comes out from them. And that is it. I'm going to go ahead and stop the recording. And